All right. Well, it looks like pretty much everyone that was in the waiting room is here. So, and connected to audio. So welcome again to the first session of ACU's Staff Satisfaction Surveys Learning Collaborative. And for this session, session one, we are going to be laying the foundation for staff satisfaction surveys. My name is Suzanne Spear. I'm the Senior Director of Workforce Development here at ACU, and I am joined by some phenomenal colleagues in this learning collaborative. So you'll also hear from Helen Ray Vernier. Later on today, she is one of our training specialists here at ACU. And then we also have Mariah Blake on the line. She is our program manager, and she is, probably you might not see her face on camera, but she is definitely here working to make sure this all runs smoothly in the background. So as a little bit of background as we start our Learning Collaborative session today, so this Learning Collaborative is brought to you by the Association of Clinicians for the Underserved. And who is the Association of Clinicians for the Underserved, or ACU for short? Well, I'm glad you asked. So ACU was started about 26 years ago now as an association that National Health Service Corps alumni founded. And we've changed a little bit in the quarter of a century or so that we have been in existence, but our mission remains the same. And that is access to care for underserved populations, as well as supporting the clinicians that serve those underserved populations. We have a bunch of different programs here at ACU, many of which you can read about on our website. We have a vision services program. We have a suicide safer care training program for both physicians as well as so staff physicians as well as patients. We have, we do lots of different things. And again, you can read all about those on our website, which is clinicians.org. And one of our largest programs, one of our workforce programs, is the STAR Center, which stands for Solutions, Training, and Assistance for Recruitment and Retention. The STAR Center has been around since 2014 when we received a national cooperative agreement from the Bureau of Primary Health Care. We are one of 21 national training and technical assistance partners, as we're now known, focused on niche areas of the health center program. And obviously, the STAR Center is focused on recruitment and retention of a clinical workforce. You can find all of our resources that we're going to talk about during this learning collaborative, as well as many, many more on our website at chcworkforce.org. And if you're not already, feel free to sign up for our newsletter at there at chcworkforce.org, and you can contact us at info@chcworkforce.org. So keeping it with some little housekeeping items. So just so you all know, this meeting is being recorded and it will be posted on the discussion board. That would be a great thing to go back and listen to if there's something that you missed, you had to step away, or you just want to listen to something again. It's always there and recorded there for you. Feel free to be on camera. We know that this isn't always possible, but we love to see faces, and there'll be some times where in sessions we'll have breakout rooms, and so I know that your fellow cohort mates would love to see your face and for you to share as possible. Feel free to use the chat or unmute yourself to ask questions, share comments and thoughts. We welcome any level of interactivity. We really want these sessions to be fun and engaging for you all. And so feel free to share and ask questions throughout the sessions if you would like. Feel free to ask Mariah Blake any questions that you have. You can message her directly in your chat box. You can send her an email at mblake@clinicians.org. If you ever have a problem with anything technical related, the discussion board, anything like that, feel free to share that with her. And then last but not least, very important, if you would please make sure that you complete your evaluations after every session, and we can really see what we're doing well, what we might need to improve on, and all of that. And also you can let us know, but fill out those evaluations. It's definitely important. BIPIC loves it when we have evaluative data for them. All right. So getting into the agenda for today. So we're going to go a little bit over the purpose and the goals of this learning collaborative, as well as the methods that we're going to be using during our time together in these 5 sessions. We're going to do a little centering activity where we're going to just take some time to be present. And then we're going to do some cohort introductions. We're going to get to know each other. We want to know who is in the room. Right now we have 17 people in the room, including ACU staff. And so we're excited to get to know one another and for you all to just see who is in the room and for us to also to get to know you all as well. And then I'm going to hand it over to Helen, and she is going to go over really an introduction to staff satisfaction, really have that, really just do some level setting about staff satisfaction, why we're going to be conducting, or why we'll hope you'll be conducting staff satisfaction surveys, and then do wrap up and next steps for our next session. So with that, let's get into our learning collaborative goals. So we have some specific learning objectives we'll go over in a minute, but these are our learning collaborative goals. So we really want you all to really take some knowledge away, to learn from the materials presented, the faculty that we're going to have. So not only will you see Helen and myself during this learning collaborative, but we also have some expert faculty as well. And then each other. We definitely want this to be a peer sharing experience, as you are able to share and as you want to share what you all have done and the experience that you're going through as a part of this learning collaborative. And to that end, we would love for you all to share your challenges and your strengths that you are experiencing, implementing and responding to your staff satisfaction surveys. Feel free to arrive with questions and be open to discussion. There might be something that you're just really having a stumbling block on that you want to ask either the faculty or your peers about during these sessions. Feel free to do that. We love questions. They're fabulous. And then, leave with knowledge, new ideas and updated processes if you already have a process in place. If you don't have a process in place, right, you're here to learn one and here to implement it. And then we would love for you all to really develop and implement a strategy for implementing and responding to the staff satisfaction surveys. And along the way, we hope that you build relationships with all the people that are in this virtual room, as well as your colleagues at your health center, right? Because this is an opportunity to open the door and talk about the things that are going on at your health center with your workforce, and to really think about how you might want to respond to those as well. All right, so the tools of our learning collaborative. What modalities are we going to use in this learning collaborative? So first of all, we're going to have some didactic presentations. So each one of these 5 sessions, about 75 minutes. Today will probably be a little bit shorter just because it's a lot of intro and getting to know you and setting the stage. But didactic presentations. We'll also have time where we have discussion. So as I mentioned, we're not today, but in future sessions, we're going to be putting you guys in breakout rooms where you can have that discussion format and really talk to each other, learn, hear what each other, what all of the other health centers that are in your group are working on, learning from any pitfalls or questions that they have for one another. You're able to do that. We also have some assignments for you all. And these assignments are not just busy work. They are things that we hope that will get you thinking about surveys, your staff satisfaction surveys, about what you might hear and what you might see and what you might want to do and respond to them afterwards. So really getting you to do that and really putting some things in place so you can either implement a staff satisfaction survey or respond to them depending on where you are in that process. We also have a discussion board that will be posted on, discussion boards where we'll post the assignments, we'll post the recordings, and also you can have a chance to interact with your peers and ask questions there in a virtual format if you have some questions in between sessions there. And then finally, we will be doing, as faculty, we'll be doing some follow-up as well as check-ins along the way. One of the things that HRSA and BIPIC have asked us to do is to do a 3 to 6 month check-in after our learning collaboratives has concluded, and really just to see where you are, if you've had a chance to implement what we have talked about during our learning collaborative cohort sessions, and then answer any questions or stumbling blocks that you might have come along with implementing the things and tools that you have gained of knowledge during this time. So really, excuse me, sorry about that. Got a little happy with my clicker. So really our learning objectives, they're here to read, and you can feel free to go along with them. And also the slides will also be posted in the discussion board as well. Really here to understand the components of staff satisfaction surveys and actions needed for follow-up. We really want you all to see the value in these surveys in informing your health center leadership and also increasing your staff engagement, right? So Helen will talk a little bit about the difference between those going forward, and so you'll understand those two. And then, another thing we're going to be talking about is how do we best conduct and also follow up on the surveys, right? There's no one answer, there's no one right way, but there are a lot of ways that you can put them together that best serve your health center and the size and the type and all of that kind of good stuff. So we'll talk about that. And then again, we will come and discuss really the action steps that we need to really address any issues that have arisen during the survey process. So those are the learning objectives. And then depending on where you are in these process as far as outcomes, we hope that if you haven't already, that you will implement a staff satisfaction survey or health center, and then or also implement or update 3 policies or procedures as a response to the information gathered in your surveys, right? So, and these don't have to be huge, major things, but just 3 things to think about when you have gathered all the information and learned what what's going on with the staff at your health center, and really just 3 things that you would like to think about and change as a result of the information that you receive in those surveys. All right, so we're going to take about 20 seconds and just do a centering activity. So feel free to turn your camera off if you have it on. We're just going to take about 20 seconds to just center ourselves before we get into introductions. I know everyone has a lot of distractions and things going on, and so we're just going to take a few seconds just to get centered on ourselves and the work that we're going to be doing here during the session. So I'm going to stop my video, and 20 seconds later we'll come back and we'll do some fun introductions together. All right. So hope everyone was able to take a quick breath, and I took a quick drink of my water here, and I hope that you're excited to go in and get to know each other. All right. So what we're going to do and how we're going to do our introductions, and actually we're going to be using this medium, if you will, quite a bit during our learning collaborative. So what I would like you to do, if you could please, is a couple of different ways. You can go to menti.com and enter the numbers there that are underneath the menti.com on your screen, or you can use your smartphone and you can click on the QR code and it'll take you to Mentimeter there. So if you would please, menti.com and enter 3978540, or click on that QR code, and I'll give you guys about 5 or 10 more seconds to get there before I click on to Mentimeter. All right. So what I'm going to do is I'm going to go over to Mentimeter, and you guys are already in there. All right. So what is the name and location of your health center? So, all right, we have Biloxi, Mississippi, Greater Seacoast Community Health, which sounds like it is somewhere on the coast. So I'm very envious. I love
So it's not warm.
I'm sorry, what?
I said, we're in New Hampshire, so don't get tricked. It's not like a beach.
Well, I was in New Hampshire for the first time the other week and really enjoyed it. So awesome. Missoula, Montana, fabulous. Atlanta, Georgia, Hartford, Connecticut, South Carolina, Ohio, Delaware, Tennessee, Minnesota, Peachtree Healthcare, which maybe is in Atlanta.
We are in California. Sorry.
Okay. All right. Well, it was just a guess, but it was good. Thank you. Thank you for letting me know. Awesome. Thank you so much. Several folks from Ohio, again, Connecticut. Awesome. Well, it looks like we have a great spread of folks throughout the country, and I love that. Really get the diversity of geography and just where folks are. I love that. Wonderful. All right. Next question. What is your role at your organization? Okay, lots. Several HR directors, director of grants management, wonderful. Chief of staff, CEO, chief personnel officer, staff engagement, HR specialist. Okay, several HR directors, director of regulatory compliance and grants management. Okay, great. No, I don't know that we've had director of grants management before. So awesome, welcome. Super excited that you're here. Chief Compliance Officer, Risk Manager and Privacy Officer, Chief Operations and Compliance Officer. Awesome, great, welcome, welcome. CEO, a couple of CEOs, wonderful. Great, awesome. Well, thank you all for letting us know who's in the room and for letting the other folks know as well. All right, 2 more questions in this Mentimeter session. So how long have you been in your role? So we know we have a variety of different roles here, right? So, but how long have folks been here? So we have a couple of folks that have been in their role for a while, 10 years. That's awesome, congratulations. And then we also have several folks who have either just been in their role for a little bit, 3 years, 4 to 7, awesome. I love this. I love the variety, because we can all learn from each other, right? There can be some things that people who have just come into their role can bring in, like fresh new ideas, and then also people who have been in their role for a while really can bring their experience and all of that rich knowledge that they've gained while being in their role really can go a long way too. Awesome. All right. So last question for this one here. So what is one thing you're hoping to get out of this learning collaborative? It can be anything, really. And we love to ask this question just so we can make sure that we are really hitting the mark with the content that we are preparing for you, and really maybe add or tweak what we, our curriculum here. All right, resources, a good employee satisfaction survey. Yes, questions to ask. That is super, super important. And the person that we have coming next week, or next time rather, will really talk about some good questions to ask and the way to ask questions so you can get the answers that you would like. All right, networking, yes, love it. How to effectively address staff concerns, yes, absolutely. Interpreting results and come up with action items, perfect. Examples of questions that will get us information we can actually act on. Yes, absolutely. Great way to use employee, surveys, how to get more attention of CEO to it. Ideas shared by employees. Yes, that is fantabulous. Enhance expertise in utilizing surveys for employee engagement. How to reach out to staff who feel less than engaged while remaining a confidential survey. That's a really good one. How to take action on surveys, how to use staff satisfaction surveys, results to make impactful and lasting change for employee wellness and retention. And then I believe this is the last one to read, how to evaluate and implement feedback. Yes, 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 absolutely. Well, I love all these and really appreciate the time that you all took to put your information in here. This is great. And we will really try to make sure that each one of these items is addressed during our time looking for resources and questions and how to really do some takeaways there. So again, thank you so much. Really excited to work with all of you and hope you all enjoyed getting to know each other just a little bit. What we're gonna do, I'm gonna stop sharing here, and then Helen is going to take it away and talk to you all a little bit about staff satisfaction and then some considerations for implementing staff satisfaction surveys. And Helen, perfect. All right, take it away.
Great, thank you. Sorry, my screen sharing was being weird there for a moment, but hopefully now you
Looks
can
great
just see
now.
my slides. Great, cool. Well, thank you, as Suzanne said, for participating. Like she said, we love to know who's in the room and both your positions and sort of where your organizations are in this process. Like Suzanne said, I'm going to talk about staff satisfaction, which is a measure of workers' contentedness with their job, whether they like their job or individual aspects or facets of jobs, such as the nature of the work or their supervision. And job satisfaction can be really measured in cognitive, affective, and behavioral components. But before we dive into more of that, I just want to do even a little bit more groundwork laying of why we're even talking about this, why we talk about the workforce, and how we at the Star Center orient around this. So at the Star Center, we believe that workforce is the fuel for your health center organizational efforts. And put quite simply, if we didn't have a health center workforce, health centers wouldn't be able to see the patients that they're funded to serve and do what they're designed to do. So by having a full fuel tank of workforce, a health center identifies workforce as an essential organizational issue, invests in appropriate operational staffing resources, and has some key features. And they might look different at each organization, but these key features or core components of a robust health center workforce remain. They are a data-informed workforce plan, equitable and effective compensation structure, positive culture focused on engagement, tested recruitment and retention strategies, health professions training program, a chief workforce officer, high-functioning managers, and policies that support diversity and cultural respect. And staff satisfaction can really relate to any and all of these, and they're all areas worth considering as you begin to plan and implement this staff satisfaction survey. So employee satisfaction, as I kind of already alluded to, is quite simply just how content or satisfied employees are with their jobs. Employee satisfaction is typically measured using an employee satisfaction survey, and factors that influence employee satisfaction addressed in these surveys might include compensation, workload, perceptions of management, flexibility, teamwork, etc. And these things are all important to organizations that want to keep their employees happy and reduce turnover. So just, again, really simply, if we're looking for getting down to brass tacks kind of definition, an employee satisfaction survey is an employee feedback tool that allows employers to find out about the employee experience directly from employees themselves. And that's what's really important as we're thinking about all the different ways that we can conduct employee satisfaction or engagement surveys. Is we're really trying to hear from our staff about what is working for them, what isn't working for them, and changes they wish to see. We do want to just quickly note that employee satisfaction and employee engagement are similar concepts on the surface, and many people use these terms interchangeably, and you might even catch me doing it. But there is an important aspect of knowing the difference between satisfaction and engagement to help you make strategic decisions to create a culture of engagement. Employee satisfaction covers the basic concerns and needs of an employee. Both concepts are important, and staff satisfaction surveys can be designed to collect information on both. And then when we're thinking about employee engagement surveys, it's around the extent to which employees feel passionate about their jobs and committed to the organization. Mostly, this is just semantics. And like I said, I sometimes use them interchangeably as well, but just as you're, planning and researching and thinking about how you want to do things, different options will come up depending on what you're searching for and how you're thinking about being strategic around this, like satisfaction versus engagement. And what's most important, of course, is asking the right questions and measuring the right factors with benchmark results if possible. And through this, your organization can really construct that strategic plan to improve employee engagement and or satisfaction, and in turn, improve that performance. So hopefully, since you're all here, you're all bought into why are we conducting staff satisfaction surveys. But in case you need a little push or you need to communicate with someone else a little push, here are reasons for why conducting staff satisfaction surveys or employee engagement surveys are important. A carefully designed and conducted employee survey can really reveal a lot of information about employee perceptions that management can use to improve the workplace. Organization responsiveness to employee feedback leads to higher retention rates, lower absenteeism, improved productivity, better customer service, and higher employee morale. And the simple fact that the organization is conducting a survey can send a positive message to employees that their opinions are valued. In addition, of course, managers can gain insights into issues affecting their departments that allow them to manage more effectively. Conversely, if the senior management team is not fully committed and ready to really listen to, and most importantly, of course, act on what employees are saying, then conducting a survey can actually falsely raise expectations among employees, which will then lead to an employee relations disaster. So we do want to, we'll talk about this more as the Learning Collaborative goes on, but it's really important not just to conduct the survey, but to be really clear about the process and like how long things are going to take, and to make sure that you are actually ready to really listen, take in the feedback, and come back with results and actions, because otherwise there's nothing more frustrating than being asked what you would like to have changed and then have nothing come out of that. And again, going back to this why, of course, is why around why retention matters and why should we do something that will help reduce turnover, is that turnover is really expensive. And, speaking of the tools, as Suzanne mentioned in describing the Learning Collaborative, that some of the things we want to be providing are tools, we do want to highlight the Star Center Financial Assessment tool that can really help you answer these questions listed on the slide. It can help you understand what the actual cost of turnover is, what the cost of a provider vacancy is, how much it's costing to recruit, and how much money your organization is losing to these workforce issues, and then how you can better invest that money to retain staff and minimize those losses. So like Suzanne said, these slides will be available in the dashboard after the session, and this is a clickable link. So we encourage you to look at that if you are wondering how much turnover is costing you. And this too goes back to just understanding that throughout this whole process, both with the staff satisfaction survey, with the turnover tool, et cetera, data is so important. And without data, you're just another person with an opinion. We at the Star Center love this quote from W. Edwards Deming because it's so true. And we know that so often data can feel really overwhelming. And if you don't necessarily feel like you have like a data brain, it can feel like you're not sure what you're even going to do with these results. But it's so important to have that data, both qualitative and quantitative data, to back up the initiatives you're championing and bringing to leadership, or as a leader, you're bringing to your boards, et cetera. And this goes back to data storytelling, which is the ability to convey data not just in numbers and charts, but as a narrative that humans can comprehend. And just with any good story, a data tale has to have a beginning, a middle, and an end, and it needs to be presented without bias and with the proper empathy and context. So as we are thinking about the ways that we're going to conduct our staff satisfaction surveys, we also need to be thinking about how we'll be compiling that data, and then how we're going to use that data to tell a data story that can help decision makers understand what the needs are and how the changes and actions they're going to take will be having this impact, whether that's you as the decision maker the board of directors, your CEO, etc. So as we're going through this process, it is this, at least we're going to talk about different kinds of ways to conduct a survey. And some of them are qualitative and some of them are quantitative, but thinking about how we're going to create that story with the data is a critical, foundational piece. And then we also know that workforce shortages and workforce challenges are really real right now. And we're not trying to say that you can just conduct a staff satisfaction survey, make a few changes, and bing, bang, boom, everything's going to be fine. We know that, last year, the Great Resignation was really impacting folks. Resignation rates were the highest among mid-career professionals and in the healthcare and tech industries. And we know now there's a lot of conversations around quiet quitting, which we won't get into it, but I have some issues with ideas around quiet quitting. But generally, we know that the workforce challenges that were being faced last summer were already in place before that summer, were already in place before the pandemic, and then the pandemic just exacerbated a lot of things. So taking this into account, we want to make sure that we're addressing the problem by taking these data-driven approaches to quantify the problem or problems and identifying the root causes and making those needed changes. So staff satisfaction surveys, employee engagement surveys can be a really critical part in taking that data-driven approach and understanding those root causes. So with all that background on the why, we wanted to think about the various considerations to take into account as you begin to plan your staff satisfaction surveys. And again, this is a 5-part learning collaborative where we've got time, but we just want to plant some seeds now. And the Learning Collaborative will offer content, time, space, and a sounding board to really delve into these areas. But for now, like I said, we'll just do some considerations to get those wheels turning. So it's important to think about the type of survey. You'll need to consider what type of survey makes the most sense for your organization. The 3 most common types of employee surveys include employee opinion surveys and satisfaction surveys, employee culture surveys, and employee engagement surveys. We also are hearing a lot around employee well-being surveys. We know that there's the HRSA workforce well-being survey out there. So those aren't the only ones, but those are just some of the most common ones. It's also important to think about the timing and frequency of employee surveys. Organizations should conduct surveys of employees on a regular basis. Most companies and organizations elect to ask their employees for feedback annually. Requesting regular feedback really shows employees that the company actually cares about how they perceive their work environment. But choosing when to conduct surveys takes careful consideration. So you want to make sure you're doing it in a time where it's not especially, there's a lot of people out, or it's an especially busy time, as we head into cold and flu season. That might not be necessarily the best time, or maybe it is. Maybe you know that your staff end up having some good time to reflect during this period. There's no one size fits all, and these are decisions that you need to make as someone who knows the ins and outs of your own organization. Of course, it's important too to think about survey design prior to administering your new employee survey. You should really spend some time looking at the previous year surveys if you've conducted one before, and the results if you had any, and ask questions like, what's the driving force behind the survey? Is it just because it's time for another survey? Is the survey tied to the organization's business strategy? Lots of organizations find it useful to form a multi-level cross-functional team to really consider the organization's key objectives for conducting a survey before designing it. So it is worth thinking about, as you're thinking about the survey design, also thinking about who might be involved besides you, who what does your team for getting this survey out and then responding to it look like across the whole like lifespan of the survey and the process of the survey. It's important to think about policy issues. Most organizations don't see a need to develop policies about the conduct of periodic surveys of employees, but the employer's internal policies and practices, as well as any labor contracts, should be consistent with existing policies, rules, or labor practices. So that's important to consider. In terms of legal issues for employers, the greatest potential legal concern is that if they're using a third-party survey provider, they might have infringed on a copyright of the original survey author. So organizations should really look for registered copyright and the date of the registration in the survey materials under evaluation, and ask for copyright registration numbers to ensure that they're not exposing themselves to unnecessary risk by working with an unreliable vendor. That's of course if you're working with a third party, as I mentioned. In addition, if the organization has unionized employees, the employer must provide appropriate notifications and advanced discussions to ensure agreement to include union employees in the survey. And then you should think about employee communications. Employers should prepare supervisors and managers with advanced information about the rationale for conducting the survey, expectations on timeliness of communicating the results, plans to follow up on the results, and questions employees may ask. And again, for unionized environments, it's a good idea to also brief the union representatives and stewards on the process and the timing of the survey. And you'll hear this over and over again, as I've kind of already said it, but that transparency about the plan of how things are going to be rolled out and how the results are going to be evaluated and shared back out, and then how and when action will be taken is so important. It's also important to think about technology. Most organizations use electronic surveys now because they're more efficient and they're faster, and they use fewer resources. The ability to complete the survey via your mobile device, such as a phone or tablet, may also enhance your survey experience. But again, think about what works for you and your organization. Maybe, paper works. It feels more anonymous. It really depends on what you think works better for your organization. And then when you're thinking about the interpretation of your results, survey results should not be taken at face value, even those on the positive end of the spectrum, regardless of whether your organization is working with a third-party vendor or tabulating the results in-house. You'll need to assess the reliability of the data. Employers should also determine the format that you wish to display the results in. Again, going back to that transparency piece. And then for follow-up, organizations often establish cross-functional teams, as I already mentioned, to respond and act on survey findings. And a majority of the team should consist of non-senior employees. However, each team needs to be supported by a senior level champion whose responsibility it is to monitor and support the team. And then thinking beyond surveys is important. In addition to the information that can be generated as a result of an employee survey, some organizations also choose to initiate strategic conversations with some employees to explore those key issues more in depth. And again, we'll talk about this in a later session, some opportunities and models around that. And the hidden power of these conversations really lies in the fact that they're not about the data, but they're about dialogue, and they tend to make employees feel really valued and heard. All employees need to understand that their employers will treat their opinion with dignity and respect, though, if you are going to conduct that kind of those kinds of conversations. So with all that background, we want to hear more from you. We have another 4 questions. So it's that same Mentimeter link. So if you never exited it, I'm going to stop sharing really quickly. If you never exited it, you should be good to go. Let me get there. Okay. If you did exit it, the code is, you just go to menti.com and enter the code 3978540. And while folks are getting there, I will share our results. So our first question is whether you've conducted a staff satisfaction survey in the past. And Suzanne also put the code in the chat if anyone's struggling to get there. So it looks like, I mean, so far we're only getting yeses. That's only about half of the folks in the room, but still that's fantastic. And I think knowing that it will help us think about having you share how it's gone in the past and what are some of like your lessons learned from the past, and thinking about what you're hoping to do going forward. So yeah, of everyone who's participating, you're all yeses. That's very interesting and impressive. So our next question is, and you all did answer yes, what's the frequency then? So do you do your surveys annually, biennially, so every other year, every 3 years, or just like sporadically when it makes sense? Or are you not sure? Okay, so mostly annually. And again, that is like the general trend across, you know, most organizations. But other kinds of timing and frequency makes sense as well. All right, we'll go to the next one. So in the past, what has your participation from your staff been like? Do you get 0 to 25% of folks, 25 to 50, 51 to 75, 75 to 100, or are you unsure? So this is our most evenly split out group so far of just pulling ahead a little bit, the 51 to 75. And Suzanne, you came on camera. Does that mean you wanted to chime in?
You're very observant. I was going to say that's really impressive that at least of the folks that answered that they knew what the participation was, that 2/3 have been over 50%. That's really impressive. So awesome job.
Yeah, I agree. And we'll talk a little bit later in another session about like how to set those goals and what goals make sense. But yeah, I agree. Very impressive. All right, our final question is, so for those of you that have conducted them, what changes did you make in response to the results? And this one's just kind of open-ended, so share as much or as little as you would like. But yeah, what came out of those surveys that you've conducted? And you're also welcome to come off mute if you'd rather just share. Stricter annual review timeframes for managers. It's interesting. Purchased additional equipment. Nice. Implemented a new program, the Morale Corral. I love that. An employee and employee-based programs. Project charters focusing on the top 5 areas we scored least well. Lower level employees received across the board raise. That's great. Included staff in the incentives decision process. Explaining policies better, implemented additional trainings, more training, education, hiring of additional staff, more recognition programs, implemented a new, we already read that one. We've created a committee called the Morale Corral. I assume that's the same organization, which focuses on staff retention and incentives, purchased different supplies based on feedback, incorporated into strategic plan, started weekly email to become more transparent about changes and financials. Not sure the last one was before my time. And created employer of choice committee. Nice. Yeah, these are all amazing, and it's totally fair not to know if it was before your time. Yeah, I think that these are great. You guys have clearly been doing really wonderful with the surveys you've been conducting, and I'm so glad to hear of all these changes that you implemented as a result of learning more. So with that, I'm gonna stop doing that and go back to this one and share again. So fun, right? Okay, so thank you so much for answering those. I think that will really help inform the rest for us, the content of the rest of the collaborative. And again, I'm excited to kind of hear more. I want to create some space where you can share some of those successes that you've had across these next sessions. Both, we already have, of course, established, as Suzanne said, those breakout groups, but we'd love to also have some folks share out in larger groups across the 5 sessions to hear about the success stories. So now we're going to talk quickly about our homework and our next steps. I know you thought you were done with homework, but no, adulthood includes homework too. So our homework for you is to please read through and answer the questions on the homework assignment, which can be found in the dashboard. As you reflect, we really want you to think about how this information can help shape your next satisfaction survey. And we encourage you to keep this document and review it after you've completed your next staff satisfaction survey to see how well your perceptions match with the results. And I will say the questions of the survey kind of assume that you haven't done one yet, but you can, answer them with the knowledge in mind that you have done one and what was revealed in your previous ones. And I love that you all are asking where to find the dashboard, because that's my next slide. Whoa, we're all on the same wavelength. I love it. All right, so to get to the discussion dashboard, and this is a kind of small image, I admit, but you go to chcworkforce.org, and then in the corner, there's this thing that says log in to discussion boards, and you click that and you log in, and we have created a login for you. Is that correct?
Yes, everyone should have received a login email yesterday. It came from CHC Workforce or info@chcworkforce.org. If you did not receive an email, it might be because you previously had an account for another learning collaborative or to access our data profile dashboards. So that same login information will let you in. If it's really not letting you in, please email me and I'll be happy to help.
And again, to email Mariah, it's mblake@clinicians.org, which I'll put in there as well. So yeah, you do that. You should already have that information. Like Mariah said, you can reach out if you can't find it. And then you'll have listed in your discussion groups any of the learning collaboratives you've ever participated in, including this one, which will be the title of oh God, what is our actual title? Implementing and responding to staff satisfaction surveys. And you can click on that and it will be, this link. That one. That's also wrong because there's a comma in there when there doesn't need to be. I'm sorry.
I'll put it in, Helen.
Okay, great. Thank you, Suzanne. So yeah, that's basically how to get there. And as the weeks go on, there'll be a different OCH. I'm so distracted. I did the wrong website. It's thank you. The weeks will keep going, and like Suzanne said at the top, we'll have recordings of each session and the slides and the homework assignments, and there will also be an opportunity to post discussion questions as you're reflecting on anything or completing any of the homework assignments. If you want to, chat to the rest of the participants, your peers and colleagues between sessions. And if you come across any resources, you can post them there. We'll also put resources in there as appropriate, etc. So we encourage you to check that out. Our next wrapping up situation is to remind you to join us for the next sessions. They're all taking place on Tuesdays. The next one is Tuesday, October 4th. And then the 18th, November 1st, that says March 15th, which is a lie. I'm pretty sure it's November 17th, but that seems wrong. I will change this before we put it on the dashboard. But also we'll remind you at the November 1st one when the next one is. And yeah, please join for any and all sessions that you can. Again, those recordings will be up there if you can't make it to a session, but we really do feel that having folks in the sessions and later sessions will be a little bit more interactive, and you will be having those peer conversations. It's really useful to be here, of course. We also want to highlight some of our Star Center resources. I mentioned one earlier, that financial assessment tool, but we also just have a ton of free resources available. The two newest ones that are available and on there are the pay equity checklist and our self-care for the health center workforce checklist, and they can all be accessed using this link on this page. I also see that there's a question of where in the discussion group the homework assignments are. I believe it's just when you click, there'll be a sort of week 1 section, and within that it'll be there. Mariah, you're unmuted.
Yeah, I mean, you were answering it correctly. It's just a drop down with the session 1 with today's date on it. And then under that, there's a drop down for resources. So I've just posted the homework questions there and a link to the slides so you can download it there.
Great, thank you. So now is our time for more questions. We love that you've already been asking questions, but does anyone have any questions about the content presented today, the structure of the learning collaborative, the more questions on the discussion board, anything? We're here to answer them. While you're thinking of your questions, I'll tell you about 2 more things. So you're obviously here, so you like interactive, engaging live presentations, but we also have self-paced courses that we like to highlight and share with folks. They range in topics. We have stuff on leadership styles. We have different recruitment and retention topics. Soon, shortly, as our dear friend Jim McRae likes to say, we'll be publishing one on pathways development, which is a really exciting course that we worked with a great partner in Washington State on. They're great, like it says, they're self-paced, so you can start and stop them at your leisure. And we highly encourage folks to use those. And then we have a podcast series. There are 3 seasons out, and the 4th season is in production. And you can listen anywhere you find podcasts, or you can click that link that's listed there, and they're all on our website. And then for anything that you have questions on, you're welcome to reach out to us. Please do check out our website. There's so many resources there. You can email email info@chpworkforce.org, and that goes to a real person, and she will forward things to where they need to go. And of course, you're also very, very welcome to reach out to Suzanne or Mariah or I personally on our emails. And you can also call this phone number. I know calling is like so early odds, but we have a phone number and you can call it. So there's that. We've got a comment that there's no questions, but I'm happy to be part of this collaborative. Thank you to the Star Center for the work. Oh, thank you. We love that positive feedback. It's so great to hear that. All right, so it doesn't look like there's any other questions. If there are, that's totally fine. But in the meantime, we're going to launch our evaluation. We really appreciate folks for being here for this, ground setting, level setting session. It looks like we'll be letting you all go a little early this time. We will be using the 75 minutes for most of the sessions, just because we'll have more of that. We'll have those SMEs, and we'll have more of the opportunities for y'all to discuss as peers as well in the breakout group. So, but please do fill out that evaluation. And then I'm going to let Suzanne and Mariah field Christine's question.
I can jump in on that. Christine, if you can just email me your coworker's name, their email address, their title, and their phone number, I can add them to our cohort records and get them all set up ahead of our next session.
Helen?
Yes.
On the poll, question number 1, the ratings go 1, 4, 3, 2, 5.
You are right. I am seeing that. Mariah, should we?
Apologies.
That's okay. So will they reflect the correct answer, or is 4 actually 2?
This is such
4
a
is actually 2. Yeah,
Okay,
I'm so
so we should
sorry.
pick the bubble, not the number.
pick the bubble, not the number. Yes.
Yes.
Okay, perfect. Thank
It's
you.
like those executive function tests where you have to say the color, but not the word that the color spells, or it's like says purple,
Yes.
but it's in
Yeah.
red. That's what we're
This is
asking.
all part of the plan. Exactly.
Yeah.
Yes, so our first
Thank you so much.
question is, are you paying attention?
Yes. And Michelle gets the #1 star.
Yay, thanks.
Yeah. Great. Thank you so much. All right. Well, if you are finished filling out the evaluation, we thank you so much for being here. Sorry, I'm looking at the chat. And we want to, we look forward to our October 4th session. We'll be getting into more details on staff satisfaction surveys with a subject matter expert. And we're so appreciative for you being here. Please feel free to reach out at any point, and we hope that you have a wonderful rest of your Tuesday.